I think we can have another presentation by Dr. Rakhi R. Kurup. Again, Dr. Rakhi, before inviting, would like to inform you that you are a non-ratified member, so your paper will not be marked by the judges. So her paper is FP91. In the interest of science, we'll be hearing her influence of pupil dilatation on ocular parameters and its impact on IOL power calculation formula.
Good morning, respected dais and audience. Today I am presenting the influence of pupil dilation on ocular parameters and its impact on various intraocular lens power calculation formulae. Introduction: in the current scenario, owing to the soaring expectations of the patient, the acceptable threshold for refractive error post-cataract surgery has lowered. One of the most important pillars on which achieving emmetropia rests is the choice of accurate intraocular lens power formula, which has seen continued advances. While SRK-T, a third generation formula, has been used since ages, the newer generation formula like Barrett Universal 2, Hill RBF, Haigis Holaday 2, and Keynes are gradually taking over. The newer generation formula take into consideration several ocular parameters like axial length, keratometry, wide-to-wide distance, anterior chamber depth, which are accurately measured by optical biometer. Pupil dilation is essentially performed for grading cataract as well as pre-operative fundus examination of every patient scheduled for cataract surgery. Contrary to this, there is limited information available regarding the influence of pupil dilation on various ocular parameters and hence on accuracy of different IOL power calculation formulae, especially the newer generation ones. Purpose of the study is to assess the changes in the intraocular parameters, that is axial length, keratometry, central corneal thickness, lens thickness, wide-to-wide, anterior chamber depth after pupillary dilation, and to assess the impact of pupil dilation on the IOL formulas like Barrett Universal 2, Haigis, Hill RBF, Holaday 2, and Kane, and the SRK-T. Study design is a prospective interventional study conducted in Department of Ophthalmology at AIIMS Raipur. Inclusion criteria: the patients more than 40 years with senile cataract were included in the study. Exclusion criteria: previous ocular surgery, pupil dilation less than 6 mm, ocular comorbidities like ocular injury, uveitis, retinal degeneration, dense cataract or poor fixation requiring ultrasound biometry, other type of cataracts like metabolic drug-induced inflammatory, history of contact lens use within last 4 weeks. In reference with a recent article published by Teshigawara et al., the sample size was calculated to be 495, and this is an interim analysis of 220 patients. Methodology: the patients meeting the inclusion criteria were enrolled into the study after obtaining written consent, and visual acuity assessment is done using Snellen's chart. Preliminary ocular examination is done to diagnose the age-related cataract by slit lamp biomicroscopy examination. IOL Master 500 was used for measuring the biometric variables like axial length, keratometry, anterior chamber depth, WTW before and after pupil dilation, and lens thickness and central corneal thickness were measured with A-scan ultrasonography. Dilatation is done by instilling 1 drop of tropicamide phenylephrine 3 times at an interval of 15 minutes. Second reading is taken 60 minutes after the installation of the first dilating drop. And the IOL power calculation was done for Barrett Universal, Hill RBF, Holaday 2, Kane, and SRK-T formula based on the parameters acquired before and after dilation. Our results that influence of pupil dilation on biometric measures before and after dilation, we have observed that there is significant difference between anterior chamber depth, WTW, lens thickness, and central corneal thickness before and after pupillary dilation. Anterior chamber depth, WTW, and CCT showed a significant increase post-dilation, and lens thickness have significantly decreased after the dilation. And the impact was seen in the Haigis, Hill RBF, and the Kane formulae that is done without using lens thickness as a parameter. And coming to the discussion, pupillary dilation is an important practice for the purpose of tests and treatments in ophthalmology. The patients are normally scheduled for at least 2 visits before the day of operation due to the uncertainty about whether the use of dilating drops would affect the IOL power calculation. It has been observed that the anterior segment physiology may change after the mydriatics. Optical biometry, that is IOL Master 500, measures the axial length along the visual axis of the eye, giving more accurate value. On the other hand, with dilated pupil, technical problems will arise with the fixation, leading to the measurement of optical axis in placement of visual axis, thus giving the erroneous results. So it is very important for us to evaluate the influence of pupil dilation in biometry measurement. Proving the hypothesis that the pupillary dilation has no effect on IOL power calculation would not only reduce the steps of the preoperative cataract surgery process but also save the time and traveling expenses for the patient. In our study, we have observed that there is significantly change of anterior chamber depth and lens thickness after the pupil dilation. This is because as the ciliary muscle relaxes due to pupil dilation, the tension on the zonules increases, lens become thinner, and anterior chamber deepens. This was also seen in an article by the Tashigawara et al. And the increase in WTW observed in our study was similar to the study by Huang et al. Huang et al. Speculated that this is mostly because of the IOL master determines the limbus by taking a photograph of the eye, detecting the boundary between paler sclera and darker iris.
Is up. Your time is up. Kindly conclude.
Okay. So preoperative biometry is regularly performed and in the department in order to determine the most accurate power of the intraocular lens. And in our study of 220 eyes, we have seen that anterior chamber depth, lens thickness, WTW, and CCT are influenced by pupil dilation, and its impact were seen in fourth and newer generation formula, which incorporates the variables. These variables, Haigis, Hill RBF, and Kane without lens thickness. On the other hand, the pupil dilation have no significant impact on the third generation formula using axial length and keratometry, most popularly the SRKT. Thank you. These are my references.
Okay, thank you for your presentation. So I would like to ask you a question, even though you're not being marked.
What's the reason for change in white to white? We can understand there is change in AC depth and other, but white to white.
Sir,
you were saying something actually.
IOL Master, we have used IOL Master 500, and it is based on the image analysis. And between after the pupillary dilation, the iris bunging and between the paler sclera, it is better to identify after that, and because of that, the results are altered.
Thank you. Thank you.
Okay, and now since it's not been reported to me, is Dr. Sridevi Nair present in the hall? Okay, she's not turned up. Okay, thank you. Thank you all this. So,
would you like to present Dr. Manpreet on her behalf? We can just listen to the essay. You don't have. Okay, fine. Yeah. Thank you.